Constipation is a very prevalent problem in our country because in a recent survey conducted in India, the prevalence is around 8 to 20%. That is, in some areas, there is 20 people out of 100 suffering with constipation. So, what is the ideal a lame term of constipation? So, it is infrequent passage of stools, which is associated with difficulty in passage. But the scientific definition for this term is less than a three stool passages per week. So that should be at least for 3 months. Then it is termed as a chronic constipation. But nowadays, in our Indian survey, they have changed definition to if you are passing very hard pellety type of stools, that is actually calculated by the Bristol stool score. So there is a stool score which actually divides into 1, 2, 3, 4, 5, 6, and 1 and 2 actually comes in the definition of a chronic constipation. So the Bristol score 1 and 2 actually terms as a chronic constipation. So if you are passing more than three stools per week, or you're passing a mushy or easy passing stool, that actually amounts to a normal amount of stool a person can pass. If you are having a difficulty in passing stools, if you are passing hard stools, so that is a hard pellety stools, which is very difficult to evacuate. And if even after passing the stool, if you have a sensation of an incomplete defecation, or some people may be using any devices or even your hand for evacuating the stool which is stuck in your anus on the rectum, that all constitutes to symptoms of constipation. But there are specific subtypes of constipation where the person will not even have the urge to pass the stool. He will pass a stool in 3 to 4 days. This type of constipation is called slow transit constipation. The another type of constipation is patient will have an urge to pass stool, but there will be some kind of obstruction level at the level of anus that actually comes in terms of a dyssynergia. The other part, person who has a constipation along with symptoms of abdominal pain or bloating or vomiting, they might be under a condition called inflammatory bowel disease, that is constipation subtype. So these three subtypes of constipation needs to be evaluated by a specialist gastroenterologist and has to be treated according to their treatment protocols. But if you have some acute symptoms like severe abdominal pain, vomitings, and you are unable to pass even flatus or stool, that actually you have to go to an emergency department treating like it might be a sign of an intestinal obstruction. There are even alarm symptoms like if you have a constipation in your elderly age, if you have a constipation with any passage of blood in your stools, if you have a family history of any colonic or abdominal malignancy, if you have a weight loss with constipation, fever along with constipation or lump, so these 6 signs are actually alarm symptoms which might indicate any malignancy. So you have to immediately get evaluated by a gastroenterologist for ruling out any type of a malignancy or a cancer in your abdomen. Common cause of constipation constitutes a basic inadequate unhealthy lifestyle. That is, if you have a sedentary lifestyle, if you don't have enough activity or exercises, if you have to stuck onto your computer or don't have work, that leads to constipation. Second is inadequate water intake and inadequate fiber in your food. So commonly people are not eating healthy food options or getting food delivery options, or not taking home cooked intake, and inadequate intake of vegetables. These are the general causes of constipation, but medical causes like hypothyroidism, diabetes, even any drug intakes like antihypertensives, anti-diabetic drugs, these are all or many types of drugs can also cause constipation. I generally advises you have to take adequate amount of water. So you have to take at least 3 to 4 liters depending on the climatic change. In the cold, a little less amount, but in the hot, if you have a dehydration going out, you have to take more amount of water. You have to do a regular proper exercise, some kind of activity, which is a must for your movement of your colon or your bowels. Third is patient should be having some amount of fiber supplementation. That might be any over-the-counter available fiber components, Ayurvedic, allopathic fiber components, or any fruits which have a high fiber component can also be advisable. But if you have a specific disease like a inflammatory bowel disease subtype, then you have to choose and search for a FODMAP diet. FODMAP is fermentable oligosaccharides, disaccharides, and monosaccharides. So these kind of diet should be avoided if you are having an inflammatory bowel disease. For this, you have to consult your specific gastroenterologist for and see which diet is suitable for you and which you should avoid. If you have an urge to pass stool, do go and pass a stool. Do not try to hold your stool, because if you try to hold your stool, what happens is the whatever stool is present in your rectum gets dehydrated, solidified, and that leads to pressure in your perianal region on your muscles, leading to these complications of piles and fissure. So that is the first advice I would like to give. Second thing is, Indian commode is actually more comfortable and more physiological compared to a Western commode, because in your Indian commode, you have a squatting posture, which actually activates some receptors, leading to a proper posture, and you can pass stool in a more comfortable pattern without leaning forward. But if you have a Western commode, you can actually keep a chair under your legs so that your angle between your legs and your abdomen gets acute angle, and that will actually ease you in passing your stool. The other advice I would like to give is, do not use cell phone during passing your stool. That is actually a very wrong habit and should be avoided, because it actually diverts your mind, and that may be a difficulty, and there's some kind of a coordination will be disturbed while using a cell phone. The other type, if you have a constipation, in spite of all these problems, always try to pass stool 30 minutes after having your food, because after 30 minutes of having your food, even breakfast or lunch, the gastrocolic reflex will start, and that is the best time actually. It will be, your bowels will be ready to expel your stool, and that is the best time advice. But you should only strain for 5 to 10 minutes. You should not strain over 5 to 10 minutes, but because excessive straining may also causing complication in your future. But in spite of this, you are not having symptom relief, or you are having a recurrence of symptoms. That is, if you stop this fiber supplementation, you are getting your constipation back, then you should definitely refer to a gastroenterologist, where they should subtype the type of constipation, give you a proper treatment, because in a subtype of constipation like dyssynergia, fiber is actually not advisable. So that is not related. So that is, you should definitely consult a gastroenterologist. There we can advise a specific treatments, and also relaxation therapy. That is one I think I would like to add in that, because the stress itself is cause of constipation, and you have a stress-free life, and you have a relaxation therapy, which actually helps in your day-to-day life, and even your bowel movement also will be improved, because your bowel is your second brain. So whatever thoughts or emotions you have, that will be actually be seen in your bowel habits or your bowel movement also.